I'm Martin Fried. I'm Professor of Surgery and I'm Head of OBE Clinica. Today I would like to introduce you to one of the most frequently performed operations in our guests from abroad, in patients who are coming from abroad, and that's so-called adjustable gastric banding. The adjustable gastric banding is a reversible procedure, and basically the procedure is performed via placing an adjustable gastric band, which is a silicone ring, around the upper part of the stomach, creating an hourglass shape out of the stomach. The procedure acts through a mechanism which reduces the stomach volume, and you can see that the result of the operation is a very small upper part of the stomach, so-called upper pouch of the stomach. So when the patient just swallows the food goes into the small part of the stomach, stretches that part, and creates a feeling of satiety. After several hours, when the food passes through the band, then the patient is again able to eat more food. In conclusion, the patient loses weight with no major feeling of hunger, which is one of the most important things in weight loss. The procedure is performed by laparoscopy, so-called keyhole surgery, which is a minimally invasive surgery, and the scars usually are invisible in a couple of months after the operation. The operation necessitates about 2 overnight stays in the hospital, and then the patients are allowed to go home, providing they are compliant with the dietary suggestions that they get in our clinic. Bariatric operation is not a magic solution. Bariatric operation is a start for the new life and new future. However, the major need for compliance is on the patient side. The operation is going only to help the patient to stick with the diet and with other nutritional suggestions he's going to get after the procedure. And if there is no compliance in this regards, then there is no operation around the world which will help the patient to lose weight or to maintain the already achieved weight. So compliance is the key for success. The operation is only the first help to overcome the disease of obesity and other metabolic diseases. The most important things after bariatric surgery is to stick with the dietary restrictions and recommendations the patient gets. Usually after the procedure, the stomach is much smaller than it was prior to the operation, but it's up to the patient to respect the new small volume of the stomach and do not try to overfill the stomach with large portions of food. This is extremely important and in fact essential to be successful and to get very good results out of this treatment. So the compliance with the dietary suggestions and restrictions is really and indeed the most important, and respecting the small volume of the stomach which was created during the operation. So don't try to overeat and overfill the stomach. Don't try the limits of the operation. You will get a very detailed instructions how to behave, how to change your nutritional habits after the procedure. And if you are going to stick with those suggestions and recommendations, the treatment is going to be really successful.